Hey, welcome, Wendy.
Hi there, Teresa. It's so nice to see you.
It's really good to see you. It's really good to see you. And it's always good to talk to you directly and be able to be in front of you. And I just want to start by thanking you for your support and being a part of the conference again this year. It really means a lot to me.
I'm so glad I get to be a part of it. Thank you for having me.
Yeah, and the conference keeps unfolding in different directions each year. Where for the first year we were just doing kind of just basic eating disorder stuff in person, and then last year we brought in IFS and eating disorders, which was a brilliant 2-day workshop last year. And I really wanted to bring the thread through of weight stigma this year. And so it's one of the reasons why I was really hoping you would be able to present because you've been there from the very beginning of bringing weight stigma awareness, literally, tuition, with Beta. And so although the conference this year is eating disorders, weight stigma, and IFS through the IFS lens, I really wanted there to be a strong component about shame, weight stigma, and which is why I was happy to have you come along. So I'm wondering if you could just talk a little bit about how Weight Stigma Awareness Week and all of that unfolded for you, maybe a little bit about your background for anybody that doesn't know.
Sure. So I think, my background it goes back to early, early to mid adolescence with my own experience of what I would call internalized shame, which drives forward restriction, which is I think, the core of most eating disorders, not necessarily RFID, but all eating disorders have that as a core. Of course, at that time, when you're going through something like that, you have no idea of like what's happening on or thinking of yourself in a biopsychosocial realm or how cultural variables are impacting your psyche and your way of thinking about yourself. You're not thinking about that. You're just going through life. And at that time, I guess I would say, like so many people that have eating disorders, I thought I was just doing my best to be the best version of myself. But anyway, over the years, I was very fortunate to be brought into kind of the foundations of intuitive and mindful eating. That was kind of the bedrock of how I was able to recover. And then I started over the next few years, I'm really starting to understand eating disorders from a psychodynamic plane and then incorporating the impact of culture. And so that was why early in my career, I adopted what is now called health at every size principles, and just recognizing that those folks who are living in a body that isn't socially sanctioned would inevitably begin to view their body as unacceptable as is, and that probably one of the most significant aspects of healing is to actually welcome your body as is and take a point of view of self-care, self-compassion, self-knowledge as a foundation, not trying to change your body, if you will. And when we were involved with Beta, that was when I really started to talk and think more about how weight stigma impacted all forms of eating disorders, and it even impacted the sort of attack on what became the foundation of health at every size. That weight stigma is very much tied in to that as well. And I remember, coming under attack for that in certain ways early, like late 2000s, I guess, probably. And I remember thinking of that Rosa Parks quote, which was like, you must not be afraid of what you're doing when what you're doing is right. And I remember just thinking about that, and I've had such firm conviction that the link between the cultural pressures, demands upon our body, aka weight stigma, really deeply embeds shame for folks. And that is really at the epicenter of eating disorders. And then you compound whatever that is with whatever other traumas people go through, whether they're overt or covert traumas that also drive shame. And then you've got a very pernicious like core of shame that the restriction with food, um, the diet mentality is fed off of that shame. And if we only pursue recovery on the basis of like the outward behaviors and not getting to the core, then it's just a cyclic process that never really leads to healing. So that's why I care so much about shame and grateful that I get to talk about it.
Yeah, yes. Thank you for sharing kind of your personal experience with that. And that really melds beautifully with the IFS model, which is the symptoms are the protectors and the managers that help us kind of really get through life. And if all we do as clinicians in our treatment centers is contain the symptom,
Mhm.
contain the manager, and not really look at that core issue of shame, then true healing can't really fully happen.
That's really, really, really very interesting. And I think different ways that people can find language to capture their experience and become more objective about it and sort of be more mindful about the thoughts that we have and where they may be coming from, which are then, drive the emotions, whatever language and framework that helps people kind of get a handle that it can be really, really powerful. And I know so many people have felt that IFS has really been able to help them find the language that helps them be more objective and to recognize that thoughts may or may not be true and all the other stuff that helps people kind of release themselves from the grip of shame.
Yeah, and to be able to not have the eating disorder be their identity and really
Yeah,
have that separation of it's a part of me. Yeah.
absolutely. That's one of the most cunning and confusing and intense symptoms is the way the identity gets brought into the eating disorder for some people.
Yeah, exactly. Yeah. Well, I am again so grateful to
Thank
you for
you.
sharing your talk in April, and just really appreciate your ongoing support. Anything else you want to add before we close?
Oh, I just want to say that for me, being able to talk about the evolution of shame is, I think, one of the most meaningful things for me to be able to do because I think it's just such an important core issue that drives so much self-destructive behavior. And I just want to share with the audience that I'm hoping that they'll participate in an experiential part of the presentation because shame is really ubiquitous, and the more we can like identify it and talk about it and share about it, like, the less grip it has. So it's not just our patients that can struggle with it. So I hope that experiential part will go well and people will feel comfortable participating.
Oh, good, good. Yes, I forgot. Yeah, you're going to bring in some experiential work as well as your lecture. Yeah.
Yes, yes, yes.
All right. Well, thank you again.
Oh, thank you for having me, Teresa. It's always so nice to spend time with you.